Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. Catching up on a bunch of things that I wanted to go back and revisit. My team always likes doing that because sometimes we find that something old is new again. But this goes back to the Finance Committee meeting, the hearing that was on December 11th of 2023 at City Hall. And I just want you to listen to the words of Henry Garrido of District Council 37. Just listen.
Krishnan, followed by Holden.
Thank you, Speaker Adams and Chair Brennan. This question is for President Garrido, DC 37. The mayor is making sweeping cuts to the Parks Department. As we mentioned earlier, a 12% peg or cut when you consider everything, the elimination of the POP program, among other things. Your members are cleaning our parks every single day and caring for them. We're very grateful to them for their service. Can you talk a bit about how this massive cut will affect your members, our parks workers, and what are your members telling you? What are their concerns that they're sharing with you in light of these sweeping cuts?
I mean, I will say it goes into the category of broken promises. The effect on New Yorkers, first, garbage will be piling up. The ability to provide services in tree services, in parks facilities, in lifeguards across the board, won't allow us to open the beaches, won't allow us to open sections, entire sections. The amount of vacancies that we have already is mind-boggling, but to also disproportionately cut the park program that you mentioned in both sanitation in parks at a time where we're battling with rats and battling with, sanitation issues. I think it affects the quality of work life in the way that New Yorkers use parks. And I want to thank you for your leadership for speaking up about that. I just want to go back to the idea of the process. This was a hard-fought battle during the budget process where the administration had to, as any give and take, agree to make some concessions to the and so did the council, only to find out 3 months later that they want to institute the very same thing they wanted to do in the process of budget. That undermines this democratic process. At a time, I might add, that the IBO came in with today with a process that we are going to end up conservatively with a $3.8 billion surplus. To me, that is, that cries in the integrity that was raised earlier of the process, not of the individuals, but the integrity of the process. And I'm hoping that you can help us push back because your constituency are going to be the ones that are going to be most effective.
So, broken promises. Mr. Garrido, broken promises. Let's talk about broken promises. Because it's very easy for you to say it's a broken promise, but it was a broken promise that was made to us, not just by the previous executive directors of the district council, but by the city council and the administrations before you. Now, promise made should be a promise kept, and yet we keep hearing our tagline being used and reused by other unions and also by the administration. Retirees are retired unionists. They worked, they negotiated their benefits to take into retirement with them. Those promises should be kept. We held up our end of the bargain. And now, once we are retired and no longer in a union any longer, because we can't be by law, there is no reason then to sell out those people. We warn you that if you continue to allow retiree benefits to be diminished in retirement, and then diminishing a retiree benefit to a future retiree, your current members, and being disingenuous to them of what you are doing. You argued and then you litigated against the Adams administration in the past couple of weeks regarding privatization of jobs. Yet what are you doing? You are privatizing healthcare. You are privatizing the federal public health benefit of Medicare for future and current retirees. That is anti-union. You are advocating to force people into managed health care inferior to the public health benefit that they've had since 1967. You shouldn't be doing that. This will not only destroy the labor movement, this will destroy any sense that the union has to attract and retain people in them and in the jobs that they represent. Because people will not take a city job if they know that they're going to dedicate their lives to you, the union, and the municipality, and work hard for a future benefit that once they are no longer there and retired, the union will take away to sell off for bargaining for their own raises. Hoping that the young people of today don't really care what they have for the future because they're worried about right now. Or that they're too stupid to look into what the difference is of privatizing a federal public health benefit. Or they should just be grateful that they have free health care, even if it's a crappy health care plan. That's not what unions were about. Unions fought for Medicare. Unions fought for equality in healthcare. Unions fought so that there would not be discriminatory medical practices and that everyone, no matter what their income or their skin color, had access, equal access to healthcare in this country. And it was the unions that helped pass the Medicare Act in 1965. Remember that, Henry. Promises made, promises kept. It's not just a tagline. You know, like it was so easy in 2021 for you guys to say, well, of course we care for you. We're retirees in training. If you were really retirees in training, you would have listened to us because you didn't know what the hell you were doing then. And we're urging you to listen because you haven't listened to us in 2 years. Federal Medicare is a public health benefit. There are no prior authorizations other than for some cosmetic procedures, durable medical equipment, things like that. You have equal access to any doctor in America that accepts Medicare, which is 97% of the doctors in America. Aetna, and no Medicare Advantage plan for that matter. Commercial or customized like yours can say that. And if you haven't been watching our slew of videos, you should go back and listen to them. Because the plans can be diminished. Plan that you customized for New York City retirees or the MTA created for transit retirees are garbage. The networks are small. Our doctors and hospitals don't all accept this plan, and it doesn't easily travel with you like Medicare does. So, Henry, let's talk about promises. You need to start at home with the promises that were made to your retirees.